Good evening. Good evening. Welcome to the first episode of Smashing Kidney Disease. I am your host, Steve Belcher. Thank you for tuning in. Um, Also, this is the official launch of Urban Health Outreach Media. This page is designed to have weekly broadcast shows every week to talk about kidney disease and the issues at hand. Tonight on Smashing Kidney Disease, we have Curtis George from Lancaster, PA. What's going on, Curtis? How you doing?
What's up, brother? How's everybody doing?
Pretty good, pretty good. Thanks for coming on
Thank you for having
Smashing
me.
Kidney Disease, man.
Thanks for having me.
Yeah. So you just getting off of work?
Yeah, yep.
Uh-huh.
Just no work.
How's the weather up there in Lancaster, PA? Is it
Oh
cold?
man, it's cold everywhere, bro. Cold
Uh,
everywhere.
Not down in Florida.
Oh yeah, yeah.
Yeah,
We
man.
need some of that up here.
But down here in Baltimore, it's definitely cold, man. It's like about 24 degrees.
Wow.
Yeah, yeah. So, um, man, I was been following your post for a couple of years, man, and just been seeing your journey on Facebook, and I've been seeing a lot of positive quotes you've been putting on, you know, posting on Facebook. How
Yeah.
does that help you with dealing with this disease?
Absolutely. I mean, it helps me just cope with what I'm dealing with. Um, it gives me hope, and it just keeps me fighting. You know what I mean?
Mm-hmm.
It's easy to give up. It's easy to just let go and just kind of let it overtake your mind and spirit. But I have a lot of goals that I have a lot of things to live for. So,
Absolutely. So, how did you first discover you had kidney disease?
man, it was about year. It was 2010, and I was working two jobs at the time. Um, had my own place. Was doing really really well for myself. And then all of a sudden, I started getting just real sick. I was like slowly but surely getting really sick, stomach virus, and then I remember like I kept having to go to the bathroom like a lot during the day and at night. I remember at working I would have to take bathroom breaks like several times during the day. At night I would get up and go to the bathroom 3 or 4 times. It was weird. And then the when it came to a head was when I was really feeling ill. Like my stomach was terrible. I felt just nauseous all day, fatigue. I remember calling my mom because I knew something was up. Like I knew this wasn't just a regular thing. So I called my mom because she's a nurse, and I asked her, what I should do, and she told me to go, check myself to the hospital. Went to the hospital. They drew blood, and then, they determined that something's up with my kidneys, and everything from that point on happened so fast. I got admitted to the hospital the next day to a bigger hospital. Emergency surgery was done. I had a catheter put in my neck. Like everything was just so fast. They said, "Oh, boom, you have kidney disease," and that's how it happened. June of 2010 was when everything happened.
So they didn't tell you what stage that you was in, or if your kid was you still urinating at the time?
I mean, I was, but then it slowly but surely stopped. Like now, I don't go at all.
No, but in the beginning.
Oh, it's fun. Well, they said it was getting to the point where it would be end stage, and that's what eventually came to. Because at that
Right.
point, it was so far gone. At that point, it was so far gone. There was nothing anybody can do. And it's really important for people. And I'm gonna be honest with you, to get straight to the point. It's really important for black men to get checked out for these things. High blood pressure is no joke. If you don't take care of yourself and tackle the issues when they first happen, this is what can happen.
So do you think before 2010 that you were in one of the stages of kidney disease and didn't even know it?
Most likely.
And
Because the way everything happened, I'm telling you, everything just happened so fast. When I went to the hospital, the very next day is when I got surgery, the catheter put in my neck.
mm-hmm.
You know what I mean? So everything was just happening so fast, and I was the type where, I thought I was Superman before that. I was, like I said, working all the time, playing ball, working out, just living life. You know what I mean? I didn't think anything could happen. But,
Did you have annual checkups to see if you had high blood pressure?
Not really. The only time I really went to the doctor is when I needed to. If I had, I don't know, a cold or something or whatever. Like, I never really went to the doctor to get checked out like that because I thought I was invincible.
Right. Did they finally tell you what caused your kidney failure? Was it diabetes or high blood pressure?
High blood pressure, basically, which in turn like messed up my immune system, which caused all sorts of problems. So it's just one thing led to the next.
Mm-hmm. So basically, you didn't even get a chance to even try to fight the disease, to try to slow the progression, because by the time you found out, it was already too late.
It was already too late.
Wow, it is definitely important for people to get checked out. And you're right. I mean, black males, tend not to go get checked out.
Right.
I mean, as far as high blood pressure, prostate,
right,
or any type of preventable diseases.
Right.
And as they say, 9 out of 10 African Americans have stage 3 kidney disease and don't even know it.
Right.
So take us from the time you stepped into your outpatient dialysis center. How was that experience for the first time?
It was honestly surreal. I mean, like I said, I just, there's different stages of grief. I think one of the first couple of stages is denial. And I was struggling with that for a long time. I was in denial. I kept thinking that it was going to get better. I kept thinking that, this was temporary. I thought, I wasn't coming to grips with the fact that I was really sick. You know what I mean? And I just thought that, it's going to just magically go away. Because I wasn't educated on the whole thing as a whole, you know what I mean? So it was difficult in the beginning to deal with. But,
let me ask you this.
Okay.
I'm sorry to interrupt.
No problem.
When you first went in, your first day in outpatient, did they go over the consent process with you, the admission process, and did they do it in a quiet room, or was it right in the clinic? And did you have anxiety before you started that day going to the clinic?
Yeah, they were welcoming, and they educated me on what was going on, to the best of their ability. It was me, like, when I say I was struggling with it, it was something that I had to personally overcome because, like I said, I was still in denial about what was going on, and it was something that I needed to come to grips with. The people that were dealing with me in the beginning were excellent, as far as bringing me on and helping me deal with it and all that.
The clinic where you started, what size unit is it?
What size?
Yes. How many chairs?
Oh, it's I can't even remember. It's been so long ago. But
Oh, so
would
you
say
had
it's
a
a nice
different
size.
place? You at a
Huh?
different place now?
Yeah, I'm in a different place now.
Mm-hmm.
Yep.
Mm-hmm.
Still the same company, but different facility because back then I was going during the day. Now I do nights, a nocturnal shift.
Nocturnal. Can
Right.
you explain that for the people who may be watching what nocturnal dialysis is?
Well, nocturnal itself means night. I go overnight. It usually starts at 10 o'clock to 5 or whatever the case may be. It's a longer, slower, gradual process. That's why it takes so long, as opposed to going during the day. It might take you 3 or 4 hours. Um, the reason why I chose to do it this way because, well, one, since it's at night, it allows me to try to get some rest, and it frees up my schedule during the day, so I'm able to work. Do normal stuff that people do during the day. Um, and it's a lot easier on my body. I'm able to get a lot of cleaning done. I'm not feeling the really. Uh, I'm not overly fatigued after dialysis. I mean, I'm still tired, but not so much as like I would be tired doing treatment during the day. So it's a lot easier on your body. Blood pressure is lower. My lab works are have been better. So for me, it just works out.
Mm-hmm. How did you find out about that? What if someone who's, because I mean, a lot of people on dialysis. So, I mean, what if someone wanted to do that? How did you find out about that?
About nocturnal?
Yeah.
Well, I mean, the people during at my facility had told me had gone over options with me. Um, they offered a nocturnal shift. They offered home hemo. They offered peritoneal dialysis. So they educated me on the different avenues I can go to try to get my dialysis.
Mm-hmm.
At first, I was totally against nocturnal because I was worried about, because I just wanted to be in my own bed, like most people would. You know what I mean?
Mm-hmm.
But I gave it a shot. At first, it wasn't working, but I dealt with it, and it's to be honest with you, it's still very hard to do.
Why is that?
Oh man, depending on what facility you're at, they give you the facility that I'm at. They give you recliner chairs. They're not beds.
Mm-hmm.
You have wires hooked up to you. You have a blood pressure machine going off every 30 minutes. You have nurses, patients all around you. There's commotion going on here and there. So sometimes you're not able to get a nice solid sleep like you would at your own home. The familiarity of your own bed
Mm-hmm.
and etc. You know what I mean? So it's difficult in that aspect.
Right. Well, let
Um,
me ask you this.
uh huh.
I used to be the nocturnal charge nurse at a clinic in Houston, Texas, and they ran from 7 p.m. to about 4 a.m.
Okay.
And I mean, a lot of times you're right. The wires, or they're called the bedwetting alarm, is hooked up to your arm. So if you was to bleed during while you was asleep, the sensors would detect that, and it would sound, the alarm to let us know that it's some type of fluid leakage from your
Right.
access site. Are the chairs like double wide, like for
They're
a
not
large
really.
person?
No, I mean they're just regular reclining chairs, bro. I mean it's not.
Okay, okay, okay. Do they have curtains for y'all?
No.
Right,
Nope.
right, right. Yeah,
That's what I'm
but
saying. It's difficult to really like get a nice solid sleep. At least for me. Like
mm-hmm,
I've tried. I mean I take melatonin. Um,
Have you used
it just
headphones?
yeah, I have headphones. That's a must. You have to because you know how
Right,
it is. People snore. There's a lot of talking sometimes. Sometimes it can be really rough trying to get a
right.
nice sleep.
But for the people who watching that do regular dialysis 3 to 4 hours 3 times a week, just tell them the benefits that you have achieved just doing nocturnal dialysis.
Okay, well, I mean, from a lifestyle standpoint, I'm I'm 34 years old. I'm about to be 35 in February. Um, I'm a working man. I've always worked. Like I said, it frees up my schedule during the day so that I'm able to work and do the normal everyday things that people like to do. Um, like I said, the only thing is you have to sacrifice a couple nights during the week to go to the facility to do your dialysis. So that's the only drawback. From a health standpoint, my labs are a lot better. My blood pressure is lower. I don't feel the extreme fatigue from doing dialysis 3 or 4 hours during the day, because that was really some treatments are really difficult afterwards. I would be totally drained, totally washed out. Um, I'm still very tired after I leave dialysis, but I'm not drained after my nocturnal shift like I was doing during the day.
Uh-huh.
So and like I said, everything just improved. Like my labs were better. I was just overall feeling a lot better doing dialysis at night.
Okay. Hey, Curtis. Alexandra Barrios, he's out of Louisville, Kentucky.
How you doing, Alex?
Transplant warrior. He wanted to know how often are your treatments?
I still do them 3 times a week. I do a Monday night, Wednesday night, and a Friday night. I go from 9:30 to now 4:30 the following day.
Oh, 9:30 at night?
Yep, 9:30 at night, and then till 4:30 the next day.
Okay. And then, I mean, that's good because you pretty much have all day the
Right,
next day and
right,
then all day the following day before your treatment.
right, right. So usually, what I typically do is, I'll get off, I'll do my treatment, get off, go home, take a long nap, and then go to work, and or do whatever I want during the day.
What I mean, that seems like a very smart thing to do, especially for people who may be working
Right,
or maybe doing some side job or
right,
part time.
right.
Why do you think a lot of people are not doing that nocturnal?
It could be for any number of reasons, man. It could be, maybe it just doesn't work for them. It could be maybe they want to sleep in their own bed. You know what I mean? They don't mind it. Teach their own. Me. I like to. Like I said, I have to work. I
But
have goals. I this is not stopping me from accomplishing what I want to do in life. You know what I mean? So I needed to make some decisions, and that's why I wanted to do nocturnal so that I can work and get to where I want to be in life.
I agree with you, Curtis, but I agree that it may not work for a lot of people, but at the same token, this show is called Smashing Kidney Disease. And I believe as an educator and, you know, person with kidney disease as well, stage one. But when you have something that that could put you in the front of this disease and have you pretty much, kind of be in more control of your lifestyle, I mean, I would think that would be a win-win situation.
Absolutely. I mean, at
Uh,
least for me, it is.
Right. I mean, if you, especially like I know a place where they go Sunday, Tuesday, and Thursday. So if you go Sunday at say like for at your time 9:30, you'll go until Monday. You get your treatment till Monday morning at
Okay.
4:30. Then you got all day Monday. You can
Right.
sleep in your bed Monday night, and then you got all day Tuesday up until 9:30. Get off of work, get ready, just go to your treatment. And some people used to come with their pajamas on, and
That's what I do.
yeah, go there
I
with
go
your
right in.
pajamas,
Yup.
with your blanket, and
Yup.
and everything like a big quilt,
Yup.
or what you call them, a comforter,
Yup.
and just rest, get your treatment, get up, and then they'll go to work from there, and go home. And a lot
Right.
of patients that I work with that did this, they were taking off their blood pressure medicines. They had lab KT over V of
Yep.
2 or greater.
Right.
They felt a lot better. It was a win-win situation.
Right.
I think that should be promoted a lot more, but I don't think it is.
And also, you know what else? Another thing is, the idea of sitting in a chair for 7 or 8 hours straight really turns people off, to be honest with you, as opposed to 3 or 4 hours.
Mm-hmm.
You know what I'm saying? Because at least for me, that was an issue when I first started doing it. Man, do I really gotta sit here for 7 hours? Like, how am I gonna? You know what I mean? So I
Right.
think that the thought of that turns people off to it.
Alex, he wanted to know, do you inform others at your clinic about the nocturnal option, or the staff is doing it? Do you let
Yeah,
other people know
there's
about that?
yeah, it's all one facility where I'm at. Um, People, we have someone that comes around and talks to people about the different options that they offer: peritoneal dialysis, nocturnal, home hemo. So everybody is educated on what the different options that they have, or they might be available at the facility. Because some facilities won't offer that nocturnal.
Right. Yeah. Lawrence as is nocturnal procedure like hemo or PD dialysis. He don't know much. He did a little time on dialysis, but not that much time.
Okay.
But I mean, nocturnal is pretty much is hemodialysis, but just as a longer treatment. Is that
Right.
right, Curtis?
Exactly. It's hemodialysis, but it's a slower, gradual process as opposed to doing it during the day, which is usually 3 or 4 hours.
Mm-hmm. When you say slow, how slow is your blood pump, your blood flow rate? Do you know that?
I don't. I can find out. I'll get that information to you, but because since it's a slower, gradual process, it's a lot less harsher on your body, so you're not feeling the after effects of dialysis during the day, such as prolonged fatigue, just that overall general feeling of being washed out.
Right. Is that how you was feeling before you started this
Absolutely.
treatment?
I mean, yeah, absolutely. During the day, I was feeling real sick, getting migraines, um, just totally just not wanting to get up and do anything. Just my blood pressure was through the roof. Um, it was just bad. I mean, it wasn't like that all the time, but it was like that enough.
So do you
And
still get migraines?
not really, not really. Another thing is too, you're able to. I don't want to promote this, but you're able to like eat some foods that you may not have been able to eat before. You might be able to drink a lot more. I don't want to promote that. Like I'm just saying, you
Right,
might be
right.
able
No,
to
I
like
understand. You
get
got a
away
little
with
leeway, a little bit more liberal.
exactly. Usually, like when you get a migraine, it's because of a high difference in fluid. If they take too much fluid off because of that fluid imbalance, you'll get a migraine or you'll get a headache. The
Mm-hmm.
nocturnal
Mm-hmm.
shift, since it's a slower process, it's able to pull that fluid out, during the duration of that time, so you're not
Mm-hmm.
feeling those effects
Mm-hmm.
as much as you would during a treatment for 4 hours.
Mm-hmm. Alex, just wanted to point out, no, it wouldn't be in the 450 range. It would be somewhere like 300 milliliters per minute or about 250 milliliters per minute and a dialysate flow rate about 500 or maybe even lower than that. But yeah, Kurt, so are you on the transplant list?
I'm working on it. I'm actually really close to getting it. I actually just met with my transplant team last week. I've had to deal with some other complications from dialysis, so I had to take care of that stuff first.
Mm-hmm.
And my lab numbers are doing real well. So I'm just actually waiting on the transplant team to get back to me so that we can move forward.
Right, right. Do you have a support system?
Absolutely,
Mm-hmm.
absolutely.
Right. Who is your support system?
I mean, honestly, it's people, my family,
Mm-hmm.
um, people that I work with, people, just my friends and stuff like that. Um, I'm a, it, at first, I'm a real private person by nature.
Okay.
Um, I'm gonna be honest, it was real difficult for me to put myself out there, and I really still have problems doing that. But at the same time, you need that support system to help you through, you know, when you can't go at it alone. You know what I mean? You
Mm-hmm.
definitely, that's very, very important, because it's easy to get sucked up in this. It's easy to get down on yourself. It's easy to, give up, and you're definitely gonna have days where you just don't want to move to carry on. To be honest, you're gonna have days
Absolutely.
like that.
Absolutely.
You're definitely gonna have days like that where you're feeling like, why is this happening to me?
Okay.
And that's where your support system comes in. So it's very, very important to, let it be known that, hey, it's okay. Like, I'm sick, but it's not the end of my story.
Right.
You know what I mean? So
Yeah. Hey, Kurt, Lawrence asked, how is your antibodies? Is it high or low since you've been on dialysis for, a long time?
well, they're high because of I've had to have a couple of blood transfusions, and that was a what I was talking about before about these complications that I've had. Since I've had these transfusions, I've had to wait a while so that they can find an appropriate match.
Okay. Okay. Have they talked to you about any alternatives to reduce that antibody count?
No.
Because there's other people that's in that same category that you are with
Okay.
that high antibody count.
Okay.
Did you
Yeah,
know
I'll have
that?
to find out, because
Did you?
I haven't really. Go ahead.
No, I was gonna say, did you know that?
I did not know that.
Yeah. Actually, John Hopkins, they have a program where they could reduce their antibody count.
Okay. Nice. I'll have to look. I'll look into that.
Yeah, absolutely, absolutely. Um, so do you know, like the unit you go to, do you know how many chairs unit it is?
Okay. Well, the nocturnal shift, there's there's about 4 pods. Um, there's probably about 7 or 8 people, about 5 or 6, 7 people in the pods, about 28, 30, give or take.
How how rampant is kidney disease in Lancaster, Pennsylvania?
Hmm. Well, Lancaster is a small city, I would say. It's a city, but it's a smaller Philly, just more condensed. Um, I there's probably about a handful of patients that are like 40 and under, maybe 10 or less. Um,
Mm-hmm.
I would say, I would say it's enough to have. There's two facilities here in Lancaster, in the Lancaster City area. Um, and there's a facility in the rural area. So I would say it's a good amount. It's definitely a
Mm-hmm.
good amount for this area.
How many clinics are in your area? You would
Uh,
say.
about three, I think.
Mm-hmm. Have you seen an increase in people coming on dialysis since you started in the 7 years?
It's hard to say because I went from during the day to at night, so it kind of fluctuates in a way. Um, I don't know if it's increased or decreased, but it's definitely like I would say a steady amount of people
Mm-hmm.
in the facility,
Mm-hmm.
at least at the one I'm at.
Wow. Wow. So, what do you do in your spare time when you're not at treatment?
Oh man, I feel like I work so much that well, I work. I still try to keep active.
Oh, let me ask you. I'm sorry to interrupt. Let me
No
ask you
problem.
something that someone may would want to know. By you having kidney disease and going to dialysis, by you working, does that cut into your benefits or to your to Medicare?
It doesn't. But it depends on how you work it too. You have to make a certain amount to keep your benefits. You know what I mean?
Mm-hmm.
Like you have to you're able to work and still get benefits, but it has to be a certain amount.
Okay.
But yeah,
Okay.
you are able to work and get benefits. Yes.
Wow. Wow. So, I mean, when you first was diagnosed, was it hard on you?
Yeah, it was really difficult, man. I went through a lot of grief and a lot of denial, and I had to quit my job. I mean, this all happened when I was in my mid 20s, so there was a lot of things going on. I had everything just kind of happened to me all at once, and I just lost. Like I said, I lost everything. I lost my job, my car. It put a really heavy strain on the relationship I was in, and we eventually broke up. Um, I went from being, what I thought healthy and working and living my life to being dependent on a machine to live and not being able to do the things I wanted to do, not be able to eat the foods I wanted to eat, being sick and feeling worthless and just being really down on myself. It was really hard to deal with at the time. I mean, it's still hard to deal with now, but at least now, like I have an understanding about it. Well, I'm able to deal with it and um, move forward in life. You know what I mean?
So, Kurt,
And not let it stop me.
for someone who may be watching this right now and just been diagnosed and going through that, what got you through those rough times?
Um, my goals, I guess, I wanted to live life. I wanted to live life. That's what it is. You have to want to live. You have to want to be, to be happy. You have to want things for yourself. You have to want to live in order for you to really deal with it and really move forward and do the things that you need to do to be alive. If that means I need to get in the chair and sit for 7, 8 hours at night so that I can live my life, then that's what I'm going to do. If I need to cut back on milk, on phosphorus, on not eating so many bananas or oranges, or cutting back on this so that I can be healthy, then that's what I need to do. The bottom line is I want to live life. I want to be happy while I'm doing it. And, you have to want the same for yourself if you're going through it. Because it's not easy at all. I've been doing it 7 years. It doesn't get any easy. But I want to live life. I
Mm-hmm.
want to live. I don't want to just exist. I want to live life and be
Right.
happy. So I'm doing the things I need to do to be healthy and, move forward.
Mm-hmm. Do you work out?
Yeah, I work out. That's part of it too. Getting your body your body right, getting your mind together. Um, as far as working out though, you want to be careful. You want to not overdo it. Talk to your dietitian. Make sure you're eating the right foods, getting the right proteins, all that. But yeah, I do work out.
Mm-hmm. What type of access do you have?
I have a fistula. I had one on my left arm. I had it for 7 years, and it got messed up really bad. It got infected. So they cut that one off. They ligated it, and they put another one in my right arm. Actually,
Did
that
they
just happened last November.
did they tell you how it got infected?
No, it just got swollen and really it was getting painful when they were sticking, and something was up. Something was really up, and then it was just time to let it go. And I got a new one put in, like I said, last November.
Mm-hmm. Um, let me just say this. Usually, just based on experience, usually with those type of infections, it normally comes from healthcare workers not washing their hands or changing their gloves.
Mm.
Have you heard anything like that, or just seen just anything in your clinic? I mean, just not trying
Uh,
to point any fingers or anything like that, but
well, you know what? To be honest with you, I can get in. I can get into a whole. That's a whole different story with my clinic, with like professionalism and all that. But that's another story. But as far as like overall cleanliness and people using sterile technique, I think it's been pretty. It's been pretty good. I haven't noticed anything out of the ordinary or anything, um, that should be addressed in that respect.
mm-hmm.
Um, so yeah, I guess they've been pretty good with keeping things sanitary and clean and whatnot.
Right, right, right. Um, Lawrence asked, from active sport man, did you suffer deep sweats and bad eyesight, nosebleeds, and feeling tired and heavy, and slowly noticing your body changing? Headaches, did you feel this before being told? And I guess maybe being told before you had kidney disease.
Oh yeah, I definitely remember sweating a lot. Um, yeah, your body is changing. Your body, when you're going through this process, you're not getting the same. Your body is just not the same. Period. So yes, your body will feel the effects, and you will feel the effects of these changes, whether it be
Mm-hmm.
sweating, whether it be urinating a lot, whatever.
Mm-hmm. Mm-hmm. So let me ask you this. When I look at your picture that I advertised, you don't even look like you have kidney disease. Have you ever been told that?
All the time, everybody says that. People, you don't look sick. That's what they say. Um, a lot of that has to do with having a positive attitude, though. Having a great, and that's with anything in life, and it's not
Right.
necessarily just being sick. It could be you having a bad day. It could be you, whatever's going on in life. If you have a positive attitude, that goes a long way. Now, you having a positive attitude doesn't necessarily mean that things are going to be all good all the time. That's something for you to have. A positive outlook in life is something for you to have so that you can deal with whatever comes your way. Whether you being sick, whether you losing a promotion, whether you going through a breakup, whatever. Having a positive outlook on life or in general can get you through so many things.
Mm-hmm. So what do you say when people say that to you? What is your response?
I just smile and like I appreciate it. You know what I mean? I just kind of like I just like I said, I appreciate the love and like it just tells me um, that I'm doing a good job of at least um, dealing with it the best way I can.
Mm-hmm.
So yeah, just have like I said, just trying to be positive.
Wow. Wow. So how does your blood pressure run now?
It's still on the high side. It's about like 160s over like 90 or 80, give or take. Um, and I get my meds tweaked all the time. So
Mm-hmm.
it kind of it's not too high. It's definitely a lot better than it was when I was doing dialysis during the day.
Mm-hmm. Mm-hmm. Um, has the 7 years that you've been on dialysis, has this taken its toll on your body or?
Oh yeah, man, I've gone through so many things
Mm-hmm.
just from
Mm-hmm.
dialysis. And I'm sure, Plus, I'm getting older. You know what I mean? I'm about to be 35 in a couple of months, so having to deal with that, plus being on dialysis, and not the same person that you were 10 years, 7, 8, 9, 10 years ago. You know what I mean?
Mm-hmm.
Physically, mentally, and whatever. So yeah, it's definitely taking its toll. Um,
Mm-hmm.
I just try to deal with it the best I can and handle things as they come.
Mm-hmm. Do you think it's a purpose for you to be on this journey?
I think about that all the time, man. Like I think about the growth that I've gone through. Um, People that are close to dying look at life a lot differently than people that are living life regularly. You know what I mean?
Mm-hmm.
People that are close to dying appreciate things a lot more. I've certainly grown in that respect, and I look at life a lot differently and view things a lot differently, and um, I appreciate the little things a lot more and the simple things a lot more. Um, and I'm grateful for that. And I'm not sure if I would have accomplished that otherwise. So I'm grateful in the sense that I've gone through this because I've made some wonderful connections. I've met lovely people during this journey, and I've gained a sense of understanding about life because of all this. So I'm appreciative of what I've gone through because I've gained that. You know what I mean?
Mm-hmm.
So
Mm-hmm. Mm-hmm. So have you taken the steps for being on the transplant list? Like, have you went through the different tests?
oh yeah, stress test. Um, I've been tested up the wazoo with that. Trying to get on the list.
Mm-hmm. So what's holding you up? So what's the hold up?
Well, now I'm just waiting on the transplant team to get back to me. I felt like I've done everything I needed to do, and like I said, I've had to deal with other complications that I had to take
Okay.
care of first. I've had some severe inflammation problems, like all over my body. So I had to see a rheumatologist. Um, so, like I said, there have been like different obstacles I've had to get
Right.
over
Right.
before I had to go move forward with a transplant team. But I think I've completed everything I needed to do.
That's great.
So yeah, absolutely.
Let me ask you, what hospital would you be on the list at?
I'm going with Penn.
Okay. Okay. Since being on Nocturnal, have you seen uh any of the kidney warriors that get transplant?
Yeah, I have. I've some of the people that my old unit got transplants. And I'm very, 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 very happy to see them prosper. And I've actually seen people come back too because they weren't, diligent with taking their medicines and taking care of themselves in general. And I've seen them come back.
Oh, you see people get transplants and return back to dialysis?
Yep. I've seen people, get transplants and leave. I've seen people come back. I've seen people um, slowly and surely get sicker and sicker from not taking care of themselves properly. Unfortunately, even people that I've seen aren't here anymore for whatever
Right.
reason. So I've seen a lot.
So Lawrence asked, have you noticed since kidney failure your whole outlook is totally different, emotions and friends and family and relationships? How did that affect? Did they accept it?
Wow. Well, just like with anything else in life, who your real friends are when things aren't going right. You know what I mean? I've had people that I'm not that what I thought were cool fall off or get scared or whatever. Um, Even some family. Um, some of my family members, some of my close family members weren't even really getting tested to see if they were a match.
Mm-hmm.
People will come up to me, oh, why didn't your family get tested? I don't know. You know what I mean? It's just maybe they didn't think about it. Maybe they didn't even know it was an option. Um, so it just, but then I've had complete strangers, reach out to me and be willing to get tested and stuff. So it just all depends on the character of that person. You know what I mean? It
Mm-hmm.
just, I'm grateful for everything though. I'm grateful for the people that stuck around with me, and I'm grateful for the people that aren't here because that taught me, where they stood in my life. You know what I mean?
Right.
They're
Right.
just like there's a saying: when people show you who they are, you believe them.
Let me ask you this: did it ever cross your mind that your family members could be at risk as well?
Oh, absolutely, absolutely. And I would hate for someone for something to happen because they were doing something for me.
Mm-hmm.
So I completely understand, anybody being apprehensive about donating and whatnot. Completely understandable.
Wow. Absolutely. So we definitely getting down to the end of the hour, man. Is it anybody you want to send a shout out to?
I want to send a shout out to you. I want to send a shout out to everybody
Thanks,
on
man.
dialysis, anybody that's struggling, anybody that's, you know, helping us with the struggle, all the nurses, the techs out there, you're a very, very integral, important part of this process.
Mm-hmm.
And I appreciate each and every one of you guys because you're in the fight with us.
Right.
And if you're on
Absolutely.
dialysis or have any type of disease and you have a loved one or a significant other that's with you, they're fighting the fight with you also.
Right.
They're with you. They're worrying with you. They're fighting that fight with you. So I give a shout out to anybody that's in a relationship with someone that's sick and that's stuck around and still dealing with it because you're the real MVPs.
Right. Hey, Kurt, for someone who's watching right now and just been diagnosed, I mean, what words of encouragement could you leave them? Someone just starting dialysis less than a month.
It's not the end of the world. It is not the end of the road. It is not the end of the world. It seems like it's a mountain, but you will get through it. I promise you. If you have a will, there is a way. I promise you. I promise you this is not the end. You can make it. But you have to want to live. You have to want happiness for yourself. You have to want to live. You have to set goals for yourself. And you have to be realistic about the goals also. But you can make it. And you can push forward if you have a will to do so.
Absolutely. I agree with you, man. I appreciate those parting words.
Thank
Hey,
you. Thanks for
Kurt.
having me.
Hey, man, thanks for being on. I'll definitely be in touch, man.
Cool.
I definitely want to come through Lancaster, man, and do a education session in the barbershop. So
okay.
I'll get with you on that, man.
All
God
right.
bless you for being on, man. I appreciate you.
Thank you, man. Thank you, brother. Nice meeting everybody. I hope everybody has a great night, great day, and happy holidays.
You too, man. God bless. Talk to you soon.
All right, brother.
All right. All right, guys. We thank you for watching the very first episode of Smashing Kidney Disease. Stay tuned in a couple of minutes. We're going to have Sisters Against Kidney Disease with your host, Sorrell. She's going to be talking with Stephanie Stevens of Fredericksburg, Texas. Definitely looking forward to that show. Just like to thank everyone for keeping me and my dad and my family in your thoughts and prayers. Like I said, I've been through a lot within the last couple of weeks, but I'm here to let you know that in the midst of it all, I'm still standing and I want to keep faith in God. But my dad definitely took a turn for the best. And when I say that, I called him today. I mean, he's back to his regular talking self. He's not confused anymore. I saw him the other day. The fluid has pretty much gone out of his hands and his ankles, and just like a 360-degree turn. So thank you so much. Only thing is, he got to do rehab for about a week or so just to get his strength back. And we look forward to bringing him home before the holidays. So again, thanks everyone for their thoughts and prayers. And stay tuned for Sisters Against Kidney Disease with host Sorrell. Thank you for tuning in. Again, Urban Health Outreach Media. We're going to be having weekly shows, nonstop, kidney disease information, almost to the point of 24/7. Thanks for watching Smashing Kidney Disease. Good night.